still morning. Sorry, good morning, everyone.
Good morning.
Lost track of time already. I'm Jody, work in HR. So for those of you that don't know who I am or I haven't met, if you told me your name, I'd probably be like, oh yeah, I know who you are. But faces I'm not very good at. Plus I don't get to see a whole lot of people. So what we're going to go over today is open enrollment information. Open enrollment, qualifying events, the medical plans and what the plan changes are, teledoc, express scripts. We'll go through vision, dental, voluntary life and disability plans, and then the flexible spending with TASC. So I have Kelly from the Horton group, as well as Tim Otteson. So first off, open enrollment is now through November 9th. November 9th is when your enrollment forms are going to be due. Now this is the only time that you can make changes to your plan unless you have a qualifying event. So a qualifying event would be marriage. You can add your spouse to your plan, but you can't change plans. So if you're on the standard plan, you stay on the standard plan throughout the whole year. Again, marriage, you can add your spouse. Divorce, you can remove your spouse. If you have a child, you can add your children with a birth or adoption. Other things would be a gain or loss of other coverage, and then status change. So if you're went from part-time to full-time, and now you're eligible for benefits, that would also be a qualifying event. Now the qualifying events have to be done within 30 days of the actual event itself. Otherwise you have to wait until open enrollment. And now we do ask for proof of eligibility with the qualifying event form, but sometimes like Social Security card, birth certificate, you might not have within that 30 days. So provide the qualifying event form within the 30 days, and then you can give us the information later. Proof of eligibility, if it's a spouse, we would ask for either a marriage certificate or your most recent tax return showing that there is a marriage. For children, we ask for a copy of the birth certificate showing that you're the parent, or the tax return as well showing that they are dependents. Okay, so I'm going to turn it over to Tim.
All right, good morning, everyone. Good morning. Again, my name is Tim Otteson. I'm Strategic Account Manager with Aspirus Arise and WPS, and I'm thrilled, just like all of you are, to be sitting here talking about health insurance, and I do this for a living. So, by way of, for those on the video, I know most of you in the room, there is a packet of information that we'll reference throughout the presentation. Again, for those people that are watching by video, this same packet is available in the Human Resources Department. And when you open the packet, you will notice that there are two sides to the folder. On the left side is the information regarding the standard plan. And that plan is the Aspirus Arise plan that doesn't have Marshfield or Ministry. On the right side of the folder is the information regarding the extended plan. That extended plan, again, by way of reminder, is the WPS network, uses our WPS broad statewide network. So the good news for 2019 is that the county will continue to offer both plans, both the extended plan and as well as the standard plan. And we've created these fancy new benefit outlines. So on each side of the folder, I'm referencing here, what you see here is the WPS benefit outline. What this is a high-level summary of the benefits available to you. I think it's a great, tool to use, and if you want to find out what is my deductible, what is my out-of-pocket, or how does the plan cover something. This is a great tool to use. Again, what's shown here is the WPS outline, things that I would reference. The deductibles and out-of-pockets for 2019 are not changing. So you still have the same $500 deductible for single, $1,500 for family. There's only two of you, it's only $1,000 in deductible. The same co-insurance and the same out-of-pocket, $1,150, $2,300, or $3,450. And I apologize for those on the video. This is very difficult to read, but the same benefit outline is on the left-hand side of your packet. It's just, instead of being blue, it's green and orange. And this is the standard plan. Here again, the same things. The deductibles out of pockets have not changed for 2019. All right. Let's talk about some, there were a few minor changes that were made. The first change, which I want to highlight here, is in relation to office visits and related services. So right now, under Wood County's plan, if you have an office visit, that office visit is subject to a copayment, either a primary care copayment of $25 or a specialty copayment of $50. If during that visit, your doctor does blood work or labs or x-rays, all of those services basically are paid at 100%. That's very standard. I will tell you right now, most insurance carriers, they don't do that. So in order to minimize having to increase deductibles and out-of-pockets and things of that nature, as of January 1st, what will happen is if you have an office visit, that office visit charge will still be applied to a copay, but those related services will be subject to deductible and coinsurance. The exception, as noted below, is for preventive services. So if you have a preventive visit and those preventive labs and x-rays and office visits are billed as preventive services, those will still continue to pay at 100%. So I have an example here of how this works today and how it will work after January 1st. So today, for example, the person goes in, has an office visit, a blood draw, and a lab service, and their deductible and out-of-pocket hasn't been met. On the top, that office visit would be subject to a $25 copay. The blood draw and the labs then would pay at 100%. So the person would only be responsible then for $25. As of January 1st, that same office visit will continue to have the copay taken, $25, but the blood draw and labs would be subject to deductible. So in that case, the person is responsible for $155 of that visit. Keep in mind that once your deductible and out-of-pocket is satisfied, then it's paid at 100%.
But if that was preventative, you wouldn't have to pay the blood draw.
Correct. Yes. The question was if it was preventive, that's correct. If it's billed as a preventive service, then no, the deductible is waived. All right. There are a few other changes. On the left-hand side of your packet, there's a document that describes these changes. I won't belabor them. They're really quite minor. The plan will cover, as a preventive drug, these low and moderate dose statins for individuals ages 40 to 75. This maximum out-of-pocket, that's changing. That maximum out-of-pocket basically is your deductible, your co-pays, and your co-insurance. So for example, if I'm on a single plan, I'd have $500 in deductible, then $650 in co-insurance. That gets me to that $1,150 out-of-pocket that's shown on this benefit grid. To get to this $7,900 amount, I'd have to have another $6,350 in co-payments. That would be a lot of co-payments. So for the most part, you won't have to ever worry about hitting that hex amount. The autism limits, those go up each year. The county follows the state mandated benefits for autism, and every year they're adjusted annually for inflation. A couple of other changes the county is making: breastfeeding equipment, that typically was limited to in-network services. The county will now provide coverage for that out-of-network, subject to deductible and co-insurance. And then there is an additional service being added for genetic testing. All right. Just again, this is more of a reminder. The county has had this in place for a couple of years now. But under the county's plan, you have what's called a primary care copayment of $25, and then a specialty copayment of $50. And what this slide attempts to do is define the difference. What is primary care versus what is specialty care? I won't read this to you, but those are the listing of primary care physicians. So if they're one of those types of doctors, those visits would fall to a $25 copay. Specialists, dermatologists, cardiologists, those are considered specialists, and those would be the $50 copay. All right. The last thing, at least for me, is regarding the referral process. Now, this process is specific to those of you that are on or will continue to be on the standard plan only. And if you look on the left-hand side of your packet, toward the very back, you'll see this document. So, what a referral is let's say, for example, you go to an Aspirus doctor, and that doctor says, you know what, we need to refer you somewhere out of network. You need to go to Marshfield, or you need to go to Mayo for certain services. In order for those services to be paid at the in-network level, that has to be approved by Aspirus Arise. So the message that I'm giving is it's not enough that your doctor says you need to go there. It actually has to be approved through Aspirus Arise. So this document outlines the process. In the folder, there's a copy of the referral form that the provider would need to complete. Upon receipt of the referral, we'll review it, we'll make a determination, we'll send up something in writing to both you and your doctor telling you, yes, the referral is approved, or no, it's not, and here's where you should go to receive those services. Just keep in mind, though, referrals are not required in an emergency situation. You are simply to go to the nearest emergency room where services could be rendered. Again, the county just wanted me to highlight this. This would be the case under both the standard plan and the extended plan. It is always in your best interest to go to an in-network provider. And the reason for that is in-network providers agree to discounts. You know, if you go and have a surgery at Aspirus, that's in-network, they may charge $1,000 for that service. We may have a negotiated discount with them, you know, to pay $700 for that. That $300 balance is a discount. They can't balance bill you for that. In an out-of-network situation, those contractual arrangements don't exist. And so in the example here, the same $1,000 service, you go out of network, that provider can basically balance bill you for anything that wasn't paid by WPS or Aspirus Arise. And that difference, that cutback, is not applied to your out-of-pocket maximum. That's basically a penalty. So again, the reminder is, it's always in your best interest to seek care from an in-network provider. Then, very quickly, I know many of you have had questions on how to interpret your EOB. There are documents. Again, this is one of them. This is the WPS one. There's one that's similar to this, that's simply Aspirus Arise. What this attempts to do is outline how to help you better understand your explanation of benefits forms. So by way of reminder, these forms are available to you, your EOBs, online. So it's always good, if you haven't done so already, to establish an account. That way, when your claims process, you can immediately go online and look at your EOBs. The first page of the EOB typically has this breakdown of where you are at, where your family is at in terms of your deductible and out-of-pocket. The next page of that EOB basically contains the detail as to how your claim was processed. Now, you'll notice on here, and it's difficult to read on the slide, but there are a number of different numbers here. Those numbers correspond to this key. Again, and if you need this information, for those of you on the video, this document is available in the Human Resources Department. All right, I'll hand it over to Kelly from Horton.
Just a quick overview on the wellness. This isn't a change from last year, but if you did participate in the wellness activities in 2018, you're eligible for discounted premiums in 2019. The 3 core activities that you would have needed to participate in would be the biometric screening, the health risk assessment questionnaire, and the health coaching session. Any of those activities, again, that are completed in 2018 will reflect what your premiums are going to be in 2019. This information is available, I believe, in your packets. It'll also be posted on the web. The contribution costs for employees went up between 7 and 8%. So if you're curious as to what that was last year to this year, you'll look for the standard PPO plan, the Aspirus Arise. You'll see one set of rates, and then you'll see a second set of rates with the discounted rates for wellness participation. So again, if you met those wellness requirements, you'd be paying the rates at the bottom of the screen for the standard plan. We also have the listing for the statewide plan, and again, that's the broad network plan with the extended PPO. And again, you've got the contributions at the top, and then you've got the discounted rates, again, if you met those wellness requirements. Teladoc, if you haven't used Teladoc in the past, I would strongly recommend that you look into this. The best thing is going to be that you don't wait until you actually want to use the benefit to register for it. I would recommend that if you're not signed up currently, that you go on now and get registered for it. You've got a nice benefit in that you're going to pay a $10 copay as opposed to the $25 or the $50 copay for the primary care or the specialist. You have access 24/7, 365 days a year. Generally speaking, you're not going to use Teladoc for something where you know you're going to need a lab fee or you're going to need an x-ray. A lot of times it's for things like sinus infections, you've got a rash, you've got respiratory situations, etc. Normally you only have to wait about 15 minutes at most. Usually it's shorter than that to be able to get a call back. The doctors do have the ability to e-prescribe, so if your situation warrants a prescription, they can e-prescribe. You're not taking your other children out in the middle of the night to be able to go to the doctor and sit in a waiting room where there might be other people that are sick. So it's really a nice convenience for you if you happen to have pink eye or an ear infection or whatever to be able to utilize that. You can get the information, the personal and portable electronic health record. You can have the information sent to your doctor so that if you're seeing a doctor, they actually have the records from the Teladoc visit. Express Scripts, if you're taking a maintenance medication, generally speaking, that's defined as something you're taking every day, like a blood pressure medication. You can get home delivery. It's very easy to use. You can get up to a 90-day supply, and you pay the equivalent of 2 co-payments rather than 3. So if you went to the pharmacy each month, you've got to make 3 trips to the pharmacy. You'd pay a copay each time. For the mail order, you're getting a little bit of savings. It's very convenient to use. You just have to work with your doctor to get a 90-day prescription. If you call the 800 number, they'll walk you through the process. You can also start the home delivery if you go online. All the contact information is going to be in your benefit guide. Also, the PowerPoint's going to be posted, so if there's something in the presentation that you're interested in seeing, that'll be posted on the internet. For the vision plan, I just want to highlight a few things. This hasn't changed over the last year, so if you're in the plan now, I'll just go through some highlights. The first question we get frequently is, how do the frequencies work? Is it per calendar year, or how is that based? All the frequencies are going to be based on your actual date of service. So if I went in January and I got an eye exam, I'm going to have to wait until the following January to get another eye exam because there's a 12-month wait on that. If my spouse went in July, his 12-month period is going to be based on the July date. So that's true whether or not you're looking at glasses or contacts or any of those things. The frequencies will be based on your last date of service. If you're not sure when you have the last date of service, you can call Superior Vision. You can also, if you're set up to look on their website, you can go online and look at the historical information. The normal eye exam, and I'm going to focus primarily on the in-network benefits. There is an out-of-network benefit, but they're not as generous. As you can see, there's significant cutbacks as to the amount that you're going to get. The only benefit that is similar is going to be the contact lenses, where you've got $175 in-network and you've got $150 out-of-network. So you'll get the best value from the program, just like with the medical if you're using in-network providers. Again, for the basic eye exam, that's going to be paid in full at a network provider. The network is listed in the benefit guide, but it's Superior Select Midwest. So if you're on the Superior Vision website and you're looking for a provider, that's the name of the provider network. The contact lens fitting A lot of times there's a separate fee for a contact lens fitting, normally in the $40 range. That's going to count against the contact lens allowance that's shown here with the $175. So if it was a $40 fitting fee, you'd subtract that, you'd have the remainder available if you were getting contact lenses. Now you can get glasses or contacts in the same year, but not both. You notice it says in lieu of eyeglasses. So you need to think about which makes the most sense for you. If you do get materials under the plan, there's a $25 copay. Frames are covered up to $150 frame allowance in network. Contact lenses, if you choose to get those, again, are paid up to $175 less the amount that was paid for the contact lens fitting fee. Any other questions on the vision plan? The costs went up about 4%. That's not really a big increase when you look at these dollar amounts. This vision plan is highly subsidized by the county, so pretty much anybody, if you haven't looked into this before, if you or a member of your family wear glasses or contacts, the amount you're going to pay on a pre-tax basis is going to be significantly less than the value you're going to get for the eye exam as well as either the contacts or the glasses. So just something to keep in mind. The rates are guaranteed for 4 years, so you don't have to worry about joining this year and then finding out that the premiums are going up significantly next year. Again, the contact information will be listed in the benefit guide and the PowerPoint will be posted. The dental plan. I think the part that's the most confusing, yes?
I just wanted to ask you on that vision plan. I think you guys said this last year, but I just wanted to kind of clarify it. If we took a vision plan through the county and then we have a spouse takes a vision plan through somewhere else, if the vision plan through the spouse pays so much, will the county pick up and pay their share too, or is it one or the other?
Generally not. The question was if you have coverage, vision coverage, where you have coverage here and you have coverage through a spouse, will it pick up the difference? Most of the providers are set up to only take one or the other. So if you are taking both, you can certainly ask which is going to be the better deal for you, which is going to give you the best discount. But again, I don't think I mentioned this, you don't need to take coverage for your whole family. So if you know your spouse is covered elsewhere and you're not going to get a benefit, maybe you take the employee and children coverage here. So it gives you some flexibility because you've got 4 tiers, but it is generally going to be one plan or the other. You won't be able to get both. On the dental plan, the question I think we get the most, or the part that's the most confusing to people, is the difference between the PPO and the Premier and the out-of-network. PPO and Premier are both considered to be in-network providers. So when Tim was talking before, he was talking about if you go out-of-network, you can be subject to balance billing for amounts above the reasonable and customary. The same is going to be true for the dental. So if you go to a PPO or a Premier provider, you don't have to worry about any balance billing situations because you'll have discounts. The PPO benefits are going to be the richest benefits. You'll get the biggest discount. The PPO network is a narrower network, so it's a subset of the overall provider network. The Premier network includes about 91% of the dentists inside the state of Wisconsin are in either the PPO or the Premier. So you've got a lot of choices with respect to that. As you can see by the deductible, if you do utilize the PPO, which again will be the best discount, you only have a $25 deductible. Under the Premier and out of network, you have a $50 deductible. The deductible is waived for preventive on the PPO, but it's not under the Premier or the out of network. So again, another reason to go to a PPO provider if you can. Diagnostic and preventive services are covered at 100% under the PPO or Premier, or they're covered under 80% out of network. Basic services are at 80% for the PPO and the Premier, 50% out. Major services are at 50% across the board, but pay attention to the notes under the major services. If you happen to go in for the coverages where it indicates out-of-network 0, so endodontics, periodontics, oral surgery, crowns, inlays, onlays, implants, bridges and dentures, there's no coverage for those items out-of-network. So if you're covered under the plan, you can choose each time you go to the dentist whether you're going to see a PPO or Premier or an out-of-network. But keep in mind, if you have major services, you're going to want to go to a PPO or a Premier, or you won't have the benefit under the plan. Orthodontic services are covered at 50% up to a $1,000 lifetime maximum, and that covers dependents to age 19. Dependents are covered to age 26 under the plan, but if they need orthodontia, they're only covered until age 19. The biggest change for the dental this year is in the past we've had waiting periods. So if you didn't sign up for dental when you were initially eligible, or maybe you lost coverage through a spouse and didn't think about notifying HR within 30 days, if you were to come into the plan, you would have had waiting periods for basically everything that diagnostic and preventive. The county made a decision this year to remove those to be able to offer dental care to everyone across the board without any waiting periods. So if you are looking to come into the dental plan for the first time, you'll have coverage under all of the categories with no waiting period. Again, the contact information for the dental is outlined in the benefit guide. If you do have something that it falls under the evidence-based integrated care plan, it basically allows you to get up to 2 additional cleanings if you have a medical condition that's outlined here. So what happens is your 2 normal cleanings are going to get covered typically under the preventive portion of the benefit. But if you either call and self-refer, or if your dentist refers you, and you call and just indicate that I'm pregnant or whatever the situation happens to be, they'll flag your file and you're eligible for 2 additional cleanings. I believe the 2 additional cleanings fall under the major category, so they're not covered at that diagnostic and preventive benefit, but a lot of the plans will only cover the first 2 cleanings, so that is still a nice benefit. If you have questions regarding that or how it works, the easiest thing would be to call the 800 number for Delta that's on your card. The cost did not change, so even though we waived the waiting periods, the cost for 2019 will be the same as current. Again, the contact information for Delta, if you're looking for a provider, it's deltadentalwi.com. Any questions on the dental? The short-term disability. This is a voluntary program that was introduced last year. If you signed up for the program, that's great. If you didn't sign up for the program and want to look into it now, this is the one time a year that you can enroll. We do have an open enrollment every year for the short-term disability plan, whether you want to join the plan or whether you want to cancel the program. This is your opportunity to be able to do that. The benefit percentage is 66 2/3% of weekly earnings up to a maximum benefit of $1,500 per week. There is a 14-day waiting period. Most people choose to use their PTO or their sick time for that 14-day waiting period. After that, you begin to receive the 66 2/3 benefit. Now, you can't get a benefit from the county under your sick time or your PTO and also get a benefit from the short-term disability at the same time. But you could choose, kind of pick and choose as you're going through. So if you use your paid time or your sick leave for the 14 calendar days and you're thinking, well, you know, I've got 2 months of accumulated sick leave, maybe I want to use an additional 2 weeks. You can do that, but you're not going to get a benefit until after you're done using your sick leave. Most people find that if they use it for the first 14 days, they're able to preserve that bank with the county, and it is a very good benefit. Talk about the pre-X in a minute. Benefits are going to be paid on an after-tax basis because you're paying so that you're not going to be taxed on the benefits. So basically, your contributions, where for medical and dental, you're paying those on a pre-tax basis. For the long-term disability and the short-term disability, you're going to be paying your contributions on an after-tax basis. What that happens, because you're paying those on an after-tax basis, that means when you receive the 66 2/3 up to $1,500, that will not be taxed for federal or state. So it's a nice benefit to be taxed on that small portion that you're paying from a payroll deduction standpoint, but you won't be taxed on the benefit. For the short-term disability, we get a lot of questions regarding the pre-existing condition limitation. It's explained a little bit in the notes, but I'll go through it. The definition of what's considered to be a pre-existing condition when you're first joining the plan is anything where you've been diagnosed, you're receiving treatment, you're taking a prescription in the 3 months prior. So if you're looking to sign up for the first time for January 1st of 2019, anything in October, November, December is going to be a pre-existing condition. That doesn't mean you're not going to get any benefit under the short-term disability plan. If you get into a car accident on January 5th, or you break your leg, or something else happens that's not related to that pre-existing condition, you have coverage under the plan right away. If you don't have anything you're being treated for, you wouldn't actually have any pre-existing condition limitations. If you do have a pre-existing condition, so I've got a back injury, I hurt my back in November, and I'm covered under the plan for the first time in January. If I go out in February for that back injury, I'm not going to have coverage because that falls within that 6-month exclusionary period. But if I am covered under the plan and I go out in August for a back injury, I'm going to have coverage for that. So again, it's different as to how the pre-existing condition is handled versus something that's going to be an accident and not related to something that's pre-existing. Does that make sense? The long-term disability plan. Under the long-term disability plan, it's a little bit different, meaning that you have to fill out an evidence of insurability form to be able to apply for the long-term disability. They're going to ask you some health questions if you're not currently enrolled, and the carrier will determine whether or not you're eligible for the long-term disability benefit. So they may, if they approve you for the long-term disability benefit, at that point your benefit will kick in and you'll begin to pay the payroll deductions. They also could deny you, in which case you wouldn't be able to come into the long-term disability plan at that time. The benefit percentage under this one is 50% of your earnings up to $3,000 a month. Again, you're going to pay the contributions on an after-tax basis so that you're not taxed on the benefit under the federal or state. You must be disabled for 90 days. Again, this is qualified for long-term disability situations before you would begin to receive a benefit under the plan. There is a pre-existing condition limitation under this plan. It's similar to the short-term, but it's a longer exclusion period. So again, they're going to look at that 3 months prior to your effective date for determining what is a pre-existing condition. But if you have something relating to that condition, you won't have coverage if you go out on disability in that first 12-month period. So if I had that back injury scenario and I go out in November, that's still part of the first 12 months I'm covered under the plan, so I wouldn't have coverage for that. Come the following January, if you were enrolled January 1 of this year, you would have coverage for that. Again, any of the accidents and those things, if you end up being out on a long-term disability due to that, you would have coverage for those right away once you've met the 90-day disability period. Any questions on that?
Where do you get the application for that?
HR. Life and AD&D, all of the coverages now, the life, the short-term, and the long-term are all with Mutual of Omaha. As far as employees are concerned, it's not really a major change. It just makes it a little bit easier from a paperwork standpoint, because if you're on the short-term and the long-term, it eliminates some of the paperwork you have to fill out if you're disabled. The basic life insurance, the per paycheck contribution went down slightly. It went down from 69 to 58 cents a pay period. If you are looking to add any of these coverages for the first time, you will need to complete an evidence of insurability form, just like we talked about for the long-term disability. You'll ask some health questions, and again, you're either going to be approved or denied. If you're approved, that will be the effective date. If you did get married, you need to notify HR within 30 days if you want to add coverage for the spouse under the life insurance. If you have a child, you want to add dependent life, again, those are qualifying events where you can add them without having to have evidence of insurability. But if you're just looking to enroll for yourself for the first time or your children, you'll have to get those evidence of insurability forms. Again, the contact information for Mutual of Omaha is here. It's also in the benefit guide. Any questions on the LTD? For TASC, for the flexible spending account, the amount of the annual health FSA has not been established yet for 2019. They index it every year. Normally it's announced sometime in late October or early November. Right now we're assuming the amount's going to be the same as it was last year, which is $2,650. That's the amount that you can set aside. The county will send around an email if that amount goes up and you're one of those people that normally likes to set aside the full annual election. You do have a $500 carryover benefit. If this is not something that you've looked into in the past, some of the changes that Tim talked about with the health plan, where if you know you've got a number of lab fees that you have during the year, maybe this is the time that you want to set aside money in that flex account, because you can pay for your cost share under deductibles, co-payments under the medical, dental, vision, etc. If you set aside $500, you're a little nervous about doing this, you don't have to worry about the use it or lose it provision under the plan that used to be out there, because $500 will carry over automatically. That being said, if I set aside $1,000 and I only use $200, only $500 of that is going to be carried over. So you just want to be conservative when you're setting aside your amount to make sure that you'll be able to use the benefit and that you don't lose any of the monies you set aside. dependent care, so if you've got children in childcare, bless you, that need to, that are seeing a dependent care facility, daycare, you can get up to $5,000 per year per family covered under the dependent care account. The time periods for the Flex are the same as the other programs. Any other questions on the Flex?
Did the family members take their own cards?
I believe they, yeah, I was gonna say, I think it's
You get
one
one
or two.
card.
Yeah, I think you can request an extra one, but I think you pay the cost of it. It's like $5, something like that for the extra card. If you're not sure, you can reach out to the vendor. There's also some nice apps that you can use on your phone where you can take pictures of the receipts and submit them in, things like that. So if you know, maybe you've got somebody at college that doesn't have their own card, you can submit them that way. Yes?
That 500 automatically transfers, right?
Yes, the $500 for the Flex will automatically carry over. So if you've got $500 remaining in your account at the end of the year, it will transfer over, or let's say you've only got 200 remaining, that will transfer over as well. Yes?
Is this total per family? So like if my spouse's company offers the same thing, can we take it in both spots at max?
On the medical portion, yes. On the dependent care portion, no. So the dependent care is truly $5,000 per family. But if you happen to be married and your spouse has a benefit as well, if you have enough health expenses, you could set aside the $2,650, and then they could set aside whatever their maximum is. Some of the companies elect to be a little bit less than what the maximum is, so you'd have to look at that, but yes, you can do both.
Does the county have any discussion at all about doing health savings accounts, being part of that? Where that money doesn't go away. You can just keep rolling it over and rolling it over.
We've looked at it every year when we go through and we look at some of the various benefits and look to see what the costs and things are. It hasn't been something that we've had a lot of interest expressed in the past, but it is certainly something that we look into. It's just not been we didn't think that we'd have a lot of people with as generous as the health plan is select into a plan that would be health savings account eligible.
Can you even do it if you don't have the high deductible plan?
No, so they'd have to establish a separate plan. And again, you've got a pretty generous plan at the county. I know, especially as people are nearing retirement, that's something that I think a lot of people like to have because they can set aside additional monies. But at this point, there just hasn't been that level of interest.
Okay, so I'm back. As I stated in the beginning, the enrollment forms are due November 9th. You can turn those into HR. We will have a little time to review it, so if your form is not completed properly, we will be reaching out to you. And deductions for health, dental, and vision, we do pay those a month ahead of time. So those will actually start on December 6th paychecks. And then the short-term disability and FSA will start January 4th. So also, anybody that is currently enrolled in the FSA, you may see a slight difference in the amount that you are actually contributing on the last paycheck of the year. The reason for that is because of the rounding. So sometimes you may elect a certain amount to be contributed throughout the year, and that doesn't equally distribute in between 26 paychecks, or maybe you started, in the middle of the year or something. So there may be a couple cents different on that last paycheck. So just be aware of that. Now, we also changed the format of our enrollment forms, hopefully making it a little easier and convenient for our employees. The first section on the form is if you are not making any changes to your health, dental, vision, or short-term disability. So all you have to do is check the box that's listed there and then sign and date on that front page. If you do want to enroll in the short term or FSA, you do have to go to section 3 and fill that out also. So you may choose not to make any changes, but you still want to enroll at FSA, you have to fill out both portions. Now section 2 is going to be if you want to make changes. So let's say you want to switch from extended and you want to go to the standard plan. So that would be obviously a change. So you fill out section 2. If you have dependents that you either want to remove or you want to add to your plan, that's also going to be in section 2. So you'll list their information and then either remove or add. If you are adding a dependent, we will require that you have that proof of eligibility. So either a marriage certificate, birth certificate, most recent tax return, showing that there's that relationship and they're eligible to be on the plan. Again, November 9th is the deadline. Those that are participating in wellness, we do work with Adam, the wellness coordinator, who will get us a list of the individuals who will get that discount. So that'll automatically be added to your, or set up for your deductions. So lastly is going to be contact information for myself and HR. And if I'm not available, you can definitely talk to one of my coworkers. Kelly, Angel, and Kim are all well versed in this information as well. The other individual listed here is Jessica Lamar. She's at the Horton group. She works directly with Kelly and is in the office more, so her contact information is better, I guess easier to get a hold of probably than Kelly. And if she doesn't have an answer, she'll obviously reach out. Any questions you might have? Okay, and also this is the October Lunch and Learn, so you will get your 100 points, not $100, 100 points for attending. So just make sure that you did sign in on this sheet so that we have record of you attending. Okay, well, thank you.